Hello again, I'm Dr. Todd 𝐑𝐚𝐝𝐢𝐴 here at Dora Chiropractic, and in this video series we're talking about the pinched nerve. And in this one I'm going to talk about what are some signs and symptoms of a pinched nerve. So most commonly you're going to have a radiating type pain, okay? If we're talking about a pinched nerve in the neck, generally speaking you're going to have pain that's going to radiate past the elbow, okay? Because you could have an impinged nerve, say, in your shoulder, that might radiate down to the elbow. But if it's coming from the neck specifically, you're probably going to get radiating pain down all the way potentially to the hand, okay? The other symptom that you might notice is like a pins and needles. You may or may not have pain, but you could have pins and needles down in the hands, and there are specific nerve fibers. You've got an ulnar nerve, radial nerve, median nerve, and they have kind of like a map. So we can actually figure out, depending on where your symptoms are, which nerve is being irritated. But you have these several levels in your lower neck, and they all feed together. It's called your brachial plexus, which runs down. You got fibers again that come through the shoulder and then feed different parts of your arm and hand, all right? So that's a factor. The other one is you might even have pain and discomfort, you know, in that upper back, kind of that scapular area right through there. That can radiate too, or shoulder pain. A lot of times the pinched nerve can be confused with carpal tunnel syndrome. I mean, it could be. You could have pressure on the nerve here causing hand numbness, tingling, weakness, pain, things like that. Or if you're really lucky, you can have both. You can have a pressure here and a pressure here. It's called double crush syndrome. So hopefully that's not the case, all right? Pins and needles for sure as well. So not only can it feel numb from time to time, but you get that tingling feeling, almost like bugs are crawling around on it, little pin pricks, things like that. And generally speaking, when you have a pinched nerve, one of the signs and symptoms will be that the pain or the symptoms, be it pain, be it numbness, tingling, they'll be aggravated with certain positions or movement of the neck. You know, maybe you move this way and oh, it just grabs you and shoots down, right? Or maybe it's looking up an extension. Right, so certain positions, certain movement, if you're moving your neck, there's definitely a biomechanical subfailure there that's irritating the nerve, putting pressure on it, exacerbating those symptoms, okay? So what I want to do in the next video is I'm actually going to go through 5 tests to help you determine if you're actually having a pinched nerve or is it something else, okay? Because there are multiple things I could do, but we want to know, do you have a pinched nerve coming from the spine, misalignment, damage and inflammation around the joint, maybe a disc, herniated disc issue or inflamed disc. So let's watch that next video and we'll do some tests with you, okay? Thanks for watching.